So the L4, L5, S1 segment tends to be hypermobile into which direction? Flexion or extension?
Hyperextension.
Hyperextension, exactly. So, for example, if you're working on a segmental cat-cow, you want to make sure that they're focusing on flexing at the L4-5 segment versus maybe they want to work on a little bit more extension exactly at the L3, L4 segment, right? Because that's a segment that's right next to the hypermobility. So creating more mobility at L3, creating more mobility at L2 is going to be really important to get that, to get the entire spine to interact with that task that the patient needs to do. For example, if they're on their stomach doing swimming like a Superman and they're extending at L4, L5, you want to, of course, strengthen at that level into flexion, but you also want to create more mobility at the L2, L3 segment. And so it's important that you guys know exactly where L2, L3 is. I want to give you guys a couple of tips on how to identify particular areas of the spine today. So since we're here, let's start at the lowest level. So when we come in on the patient's hip, like this, on the patient's iliac crest, when you bring your hands in this way, you can put your hands on their hips and bring your thumbs in. You are going to end up at the L4, L5 interspinous space. So when you come straight in horizontally, your thumb will be in between the L4 and L5. Now the lumbar spinal segments are going to be a little bit larger, and so if you go maybe just about 1 inch above, you're going to be able to feel this, start at this L4, L5 segment. Just one segment above is going to be your L3, L4 segment. And so when you're looking at the patient's spine, doing a cat-cow into extension, when you're getting that pelvic anterior tilt to help get that extension, you want to make sure that they're extending at this segment, the L3, L4, and one more above that from the L2, L3. And so when they're in the quadruped position, you can put your hands on their hips, come in and find L4, L5, and give them the proprioceptive cue of, okay, this segment here and this segment here. Here is where you're going to want to feel the motion.